The integration of artificial intelligence, AI, into healthcare has already yielded remarkable advancements, but one of its most extraordinary possibilities lies in the realm of pre-symptomatic disease detection and treatment. Imagine a world where AI-powered systems can diagnose and even cure illnesses before they manifest, a breakthrough that would fundamentally reshape the way medicine is practiced and transform the future of human health. Throughout history, the field of medicine has largely been reactive, addressing diseases after symptoms emerge and conditions worsen. While preventive care has gained traction in recent decades, it is still primarily based on predicting risk factors rather than detecting imminent disease at its earliest stages. The concept of AI intervening before symptoms appear introduces a paradigm shift, enabling healthcare providers to move from reactive treatment to proactive preservation of health. The foundation of this revolutionary approach lies in the ability of AI to analyze vast quantities of medical data with speed, precision, and efficiency. Modern diagnostic methods often rely on snapshots of patient health, blood tests, imaging scans, and physical exams, but AI has the capacity to create a continuous and dynamic profile of an individual's physiological state. By processing information from wearable devices, genetic screenings, environmental exposures, and lifestyle patterns, AI systems can detect subtle anomalies and correlations that may otherwise go unnoticed. One of the most promising applications of this technology is in the detection of chronic diseases, such as cancer, diabetes, and cardiovascular conditions. For instance, AI algorithms could identify microscopic changes in tissue samples or minute shifts in biomarkers long before a tumor grows large enough to be detected using conventional imaging. Similarly, predictive models could pinpoint the earliest signs of insulin resistance or arterial plaque formation, enabling interventions that halt disease progression before damage occurs. In the realm of infectious diseases, AI-powered systems could monitor real-time data from global populations to identify emerging outbreaks and predict their trajectory. By analyzing patterns in travel, climate, and epidemiological data, AI could alert healthcare providers to potential pandemics, allowing for rapid containment measures. On an individual level, AI-enabled diagnostics could flag infections at their initial stages, enabling targeted treatments that prevent the spread of illness. Beyond detection, the prospect of AI curing diseases preemptively is equally transformative. Advances in gene editing technologies, such as CRISPR, paired with AI-guided analysis, could enable the correction of genetic mutations responsible for inherited disorders before they manifest. AI systems could also design personalized treatment plans based on a patient's genetic profile, lifestyle factors, and medical history, optimizing outcomes while minimizing side effects. The concept of personalized medicine, which tailors interventions to the unique characteristics of each individual, is central to this vision. AI's ability to process complex datasets makes it uniquely suited to identify the most effective treatments for specific patients. For example, in the case of neurodegenerative diseases like Alzheimer's, AI could analyze neural imaging and molecular data to recommend therapies that preserve cognitive function, even before symptoms like memory loss emerge. The integration of AI into healthcare promises to address disparities in access and outcomes, particularly for vulnerable populations. In regions with limited medical resources, AI-enabled systems could provide diagnostic capabilities and treatment recommendations remotely, ensuring that underserved communities receive timely and effective care. Mobile devices equipped with AI-powered diagnostic tools could become the front line of healthcare delivery, empowering individuals to monitor their health and seek intervention as needed. Another compelling application of AI is in mental health care, an area often underserved by traditional medical systems. AI systems could analyze speech patterns, facial expressions, and behavioral data to detect early signs of depression, anxiety, or other mental health conditions. By intervening before these conditions escalate, AI could provide targeted support and therapies that improve quality of life and prevent long-term disability. Despite the enormous promise of pre-symptomatic diagnosis and treatment, there are substantial challenges that must be addressed to realize this vision. One of the most significant barriers is the complexity of human biology itself. Diseases often involve intricate interactions between genetic, environmental, and lifestyle factors, making their prediction and prevention a highly complex task. While AI excels at pattern recognition and data analysis, its models must be continuously refined to account for the nuances of individual variability. Ethical considerations also loom large in the development of AI-driven healthcare systems. The prospect of detecting diseases before symptoms appear raises questions about privacy, consent, and the psychological impact of knowing one's health risks. Patients may experience anxiety or distress upon learning of conditions that have not yet manifested, potentially leading to overtreatment or unnecessary medical interventions. Striking a balance between proactive care and preserving patient autonomy will require careful regulation and thoughtful design. Furthermore, the reliance on AI systems for medical decision-making necessitates robust oversight and accountability. False positives or inaccurate predictions could lead to misdiagnosis, unnecessary treatments, or harmful outcomes. Ensuring that AI systems are transparent, evidence-based, and subject to rigorous validation is essential to maintaining trust in their capabilities. Access and equity are additional concerns that must be addressed. The advanced infrastructure required for AI-driven healthcare, including high-speed computing, vast datasets, and skilled personnel, may not be equally available across regions or socioeconomic groups. Disparities in access to these technologies could exacerbate existing health inequities rather than reduce them. Ensuring that AI healthcare innovations are affordable, scalable, and inclusive is critical to achieving their potential. The legal and regulatory frameworks surrounding AI in medicine also require careful consideration. As AI systems take on increasingly complex roles in diagnosis and treatment, questions of liability and accountability will become more pressing. Who bears responsibility for an error, a healthcare provider, a software developer, or the AI system itself? Establishing clear guidelines and safeguards will be essential to navigate these challenges. Despite these hurdles, the momentum driving AI-powered healthcare advancements remains strong. Researchers, clinicians, and technologists are actively exploring innovative solutions to refine diagnostic algorithms, expand treatment modalities, and address ethical concerns. Collaboration between stakeholders will be key to ensuring that AI healthcare technologies are developed responsibly and implemented effectively. As we look to the future, it is clear that AI has the potential to revolutionize healthcare in ways previously unimaginable. The ability to diagnose and cure diseases before symptoms appear represents not only a technical achievement but also a profound shift in how society prioritizes health and wellness. By shifting the focus from reactive treatment to proactive prevention, AI can empower individuals to lead healthier, longer lives while reducing the burden of disease on global healthcare systems. This vision is not without its challenges, but the opportunities far outweigh the obstacles. The pursuit of AI-powered pre-symptomatic diagnosis and treatment is a testament to humanity's ingenuity, resilience, and commitment to improving the human condition. By embracing the possibilities of AI with care and responsibility, we can create a future where health is not merely the absence of disease but a state of enduring vitality and well-being.